Interpreting arterial blood gases on the NCLEX requires a systematic approach, not just memorization. The test wants to see if you can connect the numbers to a clinical picture and a priority action. Let's break down the only 4 numbers you need to focus on under pressure: pH, PaCO2, HCO3, and PaO2. Normal pH is 7.35 to 7.45. Below 7.35 is acidosis. Above 7.45 is alkalosis. PaCO2, the respiratory driver, normally ranges from 35 to 45. Remember that CO2 is an acid in the body. HCO3, or bicarbonate, is your metabolic buffer, with a normal range of 22 to 26. PaO2 should be between 80 to 100. The most effective tool to nail these questions is the mnemonic ROME, which stands for Respiratory Opposite, Metabolic Equal. Let's apply it. A question gives you a patient with COPD and the following ABGs: pH 7.28, PaCO2 55, and HCO3 26. First, look at the pH. At 7.28, it's low, so we have acidosis. Now, which system is causing it? Let's use ROME. Check the respiratory value PaCO2. It's 55, which is high. So the pH is low and the PaCO2 is high. They are moving in opposite directions. Respiratory opposite tells you this is respiratory acidosis. To confirm, look at the metabolic value, HCO3. It's 26, which is normal. This means there is no compensation happening yet. The NCLEX won't just ask you to identify this, it will ask for the priority action. For a patient retaining CO2, the priority is to improve ventilation, perhaps by using BiPAP or adjusting ventilator settings. Now let's look at a common exam trap involving compensation. Imagine a patient with diabetic ketoacidosis has these labs: pH 7.36, PaCO2 30, and HCO3 18. The pH at 7.36 is technically within the normal range, which is a classic trick. Students might stop there and call it normal, but you must look closer. It is on the low side of normal, hinting at a compensated acidosis. Now let's find the cause. The HCO3 is 18, which is very low, indicating a metabolic problem. The pH is low normal and the HCO3 is low. They are moving in the same or equal direction. Metabolic equal tells us the primary problem is metabolic acidosis. Now look at the PaCO2. It's 30, which is also low. The respiratory system is trying to fix the metabolic problem by blowing off CO2, an acid. Because the pH has returned to the normal range, this is full compensation. The exam question here could be about recognizing that the underlying cause is DKA and the priority is insulin and fluid administration, not respiratory intervention. Another key area is recognizing respiratory failure. The NCLEX loves to test this. If you see a PaO2 below 60 or a PaCO2 above 50 in a patient who is not a chronic CO2 retainer, this signals acute respiratory failure. For example, a post-operative patient with a PaO2 of 55 and a PaCO2 of 52 is in trouble. Your immediate action is critical, likely involving oxygen therapy, elevating the head of the bed, and notifying the rapid response team. The exam is testing your ability to spot this emergency from lab values alone. Don't get so lost in the acid-base balance that you miss a critical oxygenation problem. Always check the PaO2 first. If it's dangerously low, that is almost always the priority, regardless of the pH status.